So I've been really wanting to do this video for a very long time, because I think it's something very important. So in this video, I'm going to briefly be comparing what I like to call the big three medical interpreting codes of ethics. So we need to remember that there are actually three widely recognized codes of ethics for medical interpreters. For spoken language interpreters, these codes of ethics are required knowledge for both the CCHI and NBCMI certification exams. So of course here what I'm going to be talking about today has to do with certification by the major certifying bodies in the United States for medical and healthcare interpreters. So why compare medical interpreting codes of ethics? Well, like I said, they're required knowledge for both the national medical and healthcare certification exams for medical interpreters. But because you need to know it to pass a test is a kind of lazy answer. Like many folks, I read all three codes of ethics for my first certification exam, but I didn't really absorb them. It was only when I became an interpreter trainer, putting together my ethics classes, did I begin to look at all three more in depth. And only upon looking at the codes of ethics this way, comparing and contrasting similarities and differences, did I begin to truly internalize and more fully understand the ethical framework we should be working within as medical interpreters. I truly believe it has helped me to become a better interpreter. Point blank. So real quick, let's take a peek at and compare the different codes of ethics for medical and healthcare interpreters. We're told to be familiar with all three codes of ethics from these organizations. So we have the NCIHC, the IMIA, and CHIA. Now, does anyone know what the acronyms for these organizations stand for? That's kind of the first part here, really important, because these are really big organizations and they do a lot for the field of medical interpreting. So the NCIHC is the National Council on Interpreting in Healthcare, and they have their National Code of Ethics for Interpreters in Healthcare. The IMIA is the International Medical Interpreters Association. So IMIA is actually the kind of like parent organization of the NBCMI. And the IMIA actually authored the first Code of Ethics for medical interpreters. So kind of a big deal. We should really, at the very least, be somewhat familiar with the IMIA Code of Ethics. It's very short and sweet and goes straight to the point, which is nice. CHIA, the California Healthcare Interpreting Association. They have their ethical principles for healthcare interpreters. It's included in their California standards for healthcare interpreters. Even if you're not in the state of California, CHIA's Code of Ethics is pretty legit. They have their ethical decision-making process within their standards of practice, which, even if you're going over ethics from the NCIHC, you gotta know about this ethical decision-making process. CHIA is really nice, their Code of Ethics, in the sense that it's very in-depth, very detailed, so it really helps you to kind of understand the ethical principles as outlined by the NCIHC in a little bit more depth. So they all have something different to bring to the table. So speaking of tables, I created this handy little table comparing and contrasting the different codes of ethics. So the NCIHC's Code of Ethics has 9 tenets, but there are common themes among these tenets as they outline in the 3 core values: beneficence, fidelity, and respect for culture. So beneficence is basically health and well-being. So we also have fidelity, which is faithfulness, like Fido the dog, fidelity, Fido. It is faithfulness to the message. So making sure that you're interpreting everything accurately and completely. And respect for culture, which I think is pretty self-explanatory. So the 9 ethical principles as outlined by the NCIHC are, in no particular order, advocacy. So advocacy tells us when we can advocate for a patient. So it's when their health, well-being, or dignity is at risk. We have confidentiality. Again, I feel like that's pretty self-explanatory. However, there are some key differences between these 3 codes of ethics in terms of what they say about confidentiality. We have impartiality, which means that you can't insert your own opinions, beliefs, you can't counsel patients, you cannot filter your interpretations through your own biases. Maintaining boundaries, that's all about staying within the medical interpreter's role. You have treat all parties with respect. I think that's pretty self-explanatory. However, it's important to note that respect includes respecting a patient's autonomy, their ability to make their own decisions. And then we have professionalism, which isn't so much, a lot of people like to think about this as, you wear your fancy 3-piece suit. Not so much. It's more along the lines of acting with integrity, behaving in a manner that is befitting of our profession, Professional development is all about expanding your knowledge and your skill set, constantly seeking to improve yourself as a medical interpreter. Accuracy, I like to think that one's self-explanatory. We're going to interpret everything accurately and completely. And then we have cultural awareness, which is having cultural knowledge, expanding your cultural knowledge, being aware of cultural differences and their implications. So that's long and short of the NCIHC Code of Ethics. The IMIA Code of Ethics has 12 ethical tenets, but a lot of them overlap with other tenets from the NCIHC and CHIA. I'm not going to go through all tenets in order, but I'm going to relate them back to the categories we've established thus far with NCIHC. So confidentiality, of course, we have that. It's important to note that we don't have anything that talks about the health, well-being, and dignity of the patient. We have impartiality. We do have don't interpret for family or close personal relationships. Don't interject personal opinions. That's in line with impartiality. Maintaining boundaries. So maintaining boundaries doesn't say in general that we should maintain the boundaries of the professional role, but it does specifically mention the advocacy role and the cultural mediation role, and that you should only do those things only when necessary. We're going to skip right down because we don't have anything that specifically mentions the word respect. However, we have right below professionalism. I mentioned integrity here, and you'll see why here in a moment when I start talking about CHIA's ethical principles for healthcare interpreters. I think it's really interesting that IMIA points out that we shouldn't use our position to gain favors from clients. I like that that's included because I think that mentioning that outright is important. So professionalism doesn't mention the word professionalism, but it does say don't take assignments outside of your skill level or scope of your training. So you're going to recognize your professional limitations. You need to stick to healthcare interpretation unless you have training in other interpreting specialties. We also have professional development. Now, it doesn't, again, mention the term professional development. However, it does say stay up to date on evolving language and terminology, that you should participate in continuing education, and that you should maintain ties with professional organizations. Now, for cultural awareness, we do have a mention of the cultural mediation role that says you should only engage in it only when necessary, but it doesn't say anything in particular about expanding your cultural knowledge, at least not in the Code of Ethics. So, of course, you have to keep in mind that these organizations have their Code of Ethics, and they also have their standards of practice, and oftentimes those standards of practice will expand upon these ethical principles a little bit more. So we have accuracy, of course, does not have one particular thing that says accuracy, but it does say to choose the correct mode of interpretation, which we do this to make sure that we're being as accurate as possible, right? If someone is speaking in very long, rambling phrases and we don't have an opportunity to stop them and they keep on going on, it might be more appropriate to switch to simultaneous, if possible, to maintain accuracy. It also mentions to choose the correct language, register, etc., and to also convey that, quote, spirit of the message. Now, a big reason why I like to look at IMIA and their Code of Ethics for medical interpreters is because they mention something that this is something that is mentioned in the standards of practice for some of the other medical interpreting organizations. However, I like that this is stated outright. And I think that this is something that is valuable in and of itself. It's intrinsically valuable, using unobtrusive interventions to maintain the flow of communication. So the NCIHC lays out as part of the accuracy ethical principle that we need to manage this flow of communication. But I like the fact that IMA kind of puts front and center that those unobtrusive means being unobtrusive is intrinsically valuable, and this sort of flow state, flow of communication, is intrinsically valuable. So I just like to draw attention to this, maybe not necessarily as an additional ethical principle, but something that IMIA really puts front and center that I find that is very valuable, because I often see interpreters using interventions that aren't as unobtrusive as they could be, not really fading into the background as much as I feel like they should be as an interpreter. And I really think one of my favorite things when I'm interpreting is when we hit that flow state. When I feel as if my presence there, I'm facilitating that communication as if I weren't even there. That these two people who don't even speak the same language are able to communicate as if they were. And I think that is something that is just super, super valuable. So I really like that IMIA mentions this. So that's kind of my long and short of the IMIA Code of Ethics as it compares to the NCIHC Code of Ethics. Now we're going to move on to CHIA's ethical principles for healthcare interpreters, which is embedded in their California standards for healthcare interpreters. So CHIA's standards for healthcare interpreters include 6 ethical principles for healthcare interpreters. Now these are meant to be taken into account with the health and well-being of the patient, always in the back of your mind. So these codes of ethics don't really have a definitive ranking in terms of what ethical principles we should prioritize over others. And the NCIHC, their ethical principle of advocacy, says that we should step into the advocate role when the health, well-being, or dignity of the patient is at risk. CHIA takes a different kind of approach on this, that we're always to have the health and well-being of the patient in mind. I like this because if we think about like the Hippocratic Oath, for instance, the health and well-being of the patient is of primary importance. So being in the healthcare system, being a medical interpreter, we should have the health and well-being of the patient on our minds at all times. I like this. We, of course, have confidentiality again. We have impartiality as an ethical principle. We have respect. Now, respect, instead of treat all parties with respect, we have respect for individuals and their communities. Slightly different, at least in wording. Now, the reason why for IMIA I put professionalism and integrity, I already previously spoke about this briefly, but CHIA specifically mentions integrity in its ethical principle of professionalism. It's called professionalism and integrity. I do like this. I do like that we have this specific calling out of integrity, that this is, again, put front and center. Now, in professionalism, in some of its performance measures, we do mention some things that are in line with the ethical principle of professional development as outlined by the NCIHC, but we don't have a separate ethical principle for professional development. I think it's better to be more explicit with these things because sometimes folks see professionalism and it's almost as if they turn a blind eye to this professional development component. So I do like that the NCIHC and IMIA are really more explicit about professional development. And then I also like that, so CHIA doesn't just call the ethical principle of accuracy. They call it accuracy and completeness. I like this. I like this a lot. Because accuracy and completeness are 2 different things. Accuracy is using the right words, and completeness is all about, okay, we're going to get everything. 2 completely different concepts, and I think it's important, again, to explicitly state them. Especially if codes of ethics are just something that people are going to, a lot of times, read and not really revisit in the future. I really think this needs to be something we need to be more proactive about as interpreters, but I just think it's really important to be very explicit about these things up front. And then lastly, we have cultural responsiveness is what CHIA calls it, whereas NCIHC calls it cultural awareness. So I like the fact, I really like CHIA's code of ethics, if you can't tell. Not to say that I don't like NCIHC's code of ethics, not to say I don't like IMIA's code of ethics, just there are some things that CHIA gets right, and I think they get them really, really right. And calling it cultural responsiveness, I really like this phrasing because cultural awareness just implies this kind of passive awareness of cultural differences. Whereas CHIA the wording focuses more on something that's a bit more active. Might seem like I'm splitting hairs here, but at the end of the day, we're all linguists. And I think understanding the connotations between these 2 words, awareness and responsiveness, they imply 2 completely different things. So cultural responsiveness implies that we have some cultural awareness already and that we're able to go a step further. Besides just being aware, we're actually able to respond and appropriately respond to these differences. I did just want to point out that CHIA, while it doesn't say anything about maintaining boundaries per se, CHIA really outlines the roles of the medical interpreter. So if you read the full Ethics and Standards of Practice, yes, you're going to understand the importance of role boundaries. But maintaining boundaries is not specifically separated out as an ethical principle. So that's kind of the long and short of it, the difference between these ethical frameworks of the NCIHC, the IMIA, and CHIA. So we can see they're a little bit different. And I think it's really important for us to be well-rounded ethical interpreters to be familiar with all 3 of these. I definitely highly encourage you to do your own research on this, to read all 3, to kind of draw your own comparisons. Because of course, this is my view. And in general, that's just my really simple, quick and dirty comparison of these 3 codes of ethics. Like I said, you should really read and be familiar with all 3. And to kind of highlight the importance of comparing all three codes of ethics, I want to draw your attention to the difference between what all three medical interpreting codes of ethics state about confidentiality. So in addition to comparing codes of ethics in general, we can also begin to compare ethical principles as well between these three codes of ethics. So not just ethical principles against each other, like I often do with commonly confused ethical principles like impartiality and role boundaries, but what each code of ethics has to say about a particular principle. So I do a training called Let's Talk Ethics Confidentiality for Medical Interpreters. When we look at what each code of ethics say about when we can share confidential information, there are some key differences. So you can see here that NCIHC, IMIA, and CHIA all state outright that we can break confidentiality, we can share confidential information as required by law. But IMIA and CHIA get a little bit more specific about this. They state that if there is homicidal or suicidal intent, if there is child or senior abuse or domestic violence, those are examples of when disclosure may be required by law. And these are specific examples of when we can share confidential information. The NCIHC does not contain these specific mentions. Again, I think specificity here is really important, especially with something as delicate as this. So there are some key differences here, very, very simplified in this table as a result of wanting to be brief here. But it's important to point out that if you're only looking at the NCIHC Code of Ethics, you're missing out on those sort of specifics of when required by law, which in most cases includes what is specifically laid out by the IMIA and CHIA. So this really just highlights why it's important to know all three codes of ethics for medical and healthcare interpreters. So if you're curious about that training that I mentioned, Let's Talk Ethics Confidentiality for Medical Interpreters, where I compare what all three medical interpreting codes of ethics, those big three, have to say about the ethical principle of confidentiality, you can view the training for free. It's actually on InterpretMed's YouTube channel. You should see a card pop up here on the video here in just a second. That gives you a link to that video. There's also going to be a link in the description to this video as well. In addition, this training is also now available for continuing education hours CEUs. So again, in the description of this video, there's going to be a link to the CEU eligible training, as well as a link to the free recording of the training. So please tell me what you think. Let me know if you have noticed any other differences or similarities between the three medical interpreting codes of ethics. Please don't tell me that they're all the same, because as I hope I have shown you, they are not. There are some slight differences between these three. So I highly encourage you to do your own research and probably stay tuned to my YouTube channel. Join InterpretMed even, because in our ethics club, we really do a lot of comparing and contrasting of these codes of ethics, really go in depth with these ethical principles and medical interpreting codes of ethics, which is something I believe all medical interpreters should be doing.